Member for Courtenay-Comox.
Honourable Speaker, the member for Surrey South has put forward a motion which I cannot support. I understand people's frustrations that there isn't a single magic cure that could end addictions and the carnage it leaves in its wake. We live in a time when most people know at least one person who grieves over the worst harm of increasingly toxic and lethal drugs, the death of a loved one, a colleague or neighbour, someone in our community. This alarming rise in the number of people dying precipitated the declaration of the public health emergency in 2016. Chief amongst the factors leading to death by illegal substances is the stigma that results in people using alone and dying alone. In a step to break free of the stigma, BC sought and the federal government granted a 3-year decriminalization pilot. At the 2023 announcement, we heard the powerful testimony of Catherine Botchford, who spoke about the need to end stigma. She spoke about her husband, Jason Botchford, a well-known sports reporter who was a victim of illicit toxic drugs in 2019. After 17 years together, her reaction was that it must be a mistake. She said, we have 3 young kids. He knows the risks. And yet he died, and he died alone. She said the stigma that comes with using substances is dehumanizing, and people feel they must suffer in silence, alone. Her instinct was to tell her kids that he died of a heart attack in order to protect them. But then they began learning about substance use at school, and she realized she was enabling an environment of secrecy, unconsciously creating shame. So she sat down and told them the truth. She said they were more mad that she had kept the truth from them than how he had died. She ended by saying we all have a responsibility to change the narrative on substance use and the stigma associated with it. Treating drug use as a public health matter and not criminalizing people who use drugs is a step forward towards ending stigma. It is a step to ending the life-threatening behaviors like using in secret, alone. People are more likely to get the help they need if they know they will be supported and not found wanting. On the 1-year anniversary of the 3-year decriminalization pilot, the Federal Minister of Mental Health and Addiction says, the data is clear. Fewer people are being criminalized for personal possession, and more people are accessing life-saving services, including treatment. As the first exemption of its kind in Canada, she goes on, we will continue to work closely with British Columbia to monitor impacts, learn as we implement, and make adjustments as needed. And yet, we now have the member opposite pushing for an end to this important initiative. Only a year ago, the member said in a CBC interview, does it mean that our party doesn't support decrim or harm reduction? Absolutely not. We do. With our whole hearts, we want to save people. As BC's Minister of Mental Health and Addiction says, of the member opposite's call to end decrim today, cancelling this program won't save a single life, but it will divert police away from focusing on serious drug trafficking and crime. It will make it harder for people to reach out for help and treatment. Today, more people are reaching out as the province builds a strong continuum of care and expands the number of treatment and recovery beds, services, and housing options. It's also reassuring to see that law enforcement continues to be at the table as we work together to end stigma and save lives. As a previous speaker noted, Deputy Chief Fiona Wilson, President of the BC Association of Chiefs of Police, said of this complex public health crisis, we stand committed in our desire to not criminalize those who use drugs, but to redirect individuals to alternate pathways of care. Just as we learned that corporal punishment is not the way to alter the behaviors of children for the better, arresting people with addictions will not help. And we know that being consistent over time is what leads to success. As Catherine Botchford said, we all have a responsibility to end the stigma for those who struggle with addictions. And I say that begins with leaders who stay the course, not flip-flopping and falling prey to inconsistent reactions to the frustrations that come with complex problems like the public health emergency that is the toxic drug deaths. Thank you, Mr. Speaker.